Hi there, Doc Davis, orthopedic spine and neck specialist. Here are the most important things that you need to know about cervical myelopathy. Cervical myelopathy is a condition that results from spinal cord compression in your neck. There are several causes of potential compression on the spinal cord in the neck. The most common would be a herniated disc, a bone spur, or arthritic wear and tear changes. Cervical myelopathy is the most common cause of spinal cord compression in patients over 50, so I tend to see this diagnosis in older patients that I treat. Symptoms of cervical myelopathy are varied. They can range from neck pain, pain between your shoulder blades, or even headaches. One of the most common symptoms in cervical myelopathy is hand numbness. Usually both hands are numb. It can be sometimes confused with carpal tunnel syndrome. Carpal tunnel syndrome usually involves just 3 fingers in your hand, these 3. Typically with cervical myelopathy, all fingers in the hand are numb and it's usually both hands. Other symptoms that result from cervical myelopathy relate to spinal cord dysfunction. This would be symptoms such as hand clumsiness. So you have a difficult time picking up objects off of a countertop. Issues with fine motor coordination, such as buttoning a shirt or getting change out of your pocket. Other times patients will notice that they have a change in handwriting and they find it much harder to write legibly. One other symptom of cervical myelopathy affects balance. Many times patients with spinal cord compression in their neck find that they're unsteady on their feet, either when walking in a straight line or sometimes just when stopping and turning, they're off balance. So if you start having problems with your balance and you have other symptoms including neck pain or headaches or hand numbness, this may be a sign of spinal cord compression in your neck. A lot of times there's not a lot of pain associated with cervical myelopathy. This is different from a pinched nerve or a herniated disc in the neck that a lot of times will cause pain shooting down the arm or into the hands. If you have symptoms that might be consistent with cervical myelopathy, it's helpful to get this evaluated. Common tests to evaluate for cervical myelopathy would be x-rays of the neck, an MRI, and sometimes a CAT scan of the neck to look for causes of compression in the spinal cord. There are other causes of poor balance and hand numbness like I talked about, and those will be investigated as part of a workup to see if you have compression on your spinal cord. If you're diagnosed with cervical myelopathy, the treatment can be anywhere from observation to surgical intervention. There was a well-published study several years ago that identified that about 20 to 70% of patients that have cervical myelopathy will have progression or worsening of their symptoms. So not every patient that has spinal cord compression and even symptoms will get significantly worse or even need surgery, which is nice to know. However, if you do have enough compression on your spinal cord and neurologic dysfunction, surgery can be the only helpful and most recommended treatment. We have studies to show that if you have surgery for cervical myelopathy, you should expect a 70% chance of neurologic improvement, adding to a significant increase in your quality of life and functional level. There are different ways to treat cervical myelopathy surgically. This includes operating on the front of the neck or sometimes on the back of the neck. Typical surgery to treat cervical myelopathy, whether it's performed on the front or the back of the neck, takes about an hour and a half or 2 hours, and usually will require 1, maybe 2 nights in the hospital. Total recovery takes about 2 months. Even though surgery involves recovery and risks, it can put you on a pathway for substantially better neurologic function. If you think you may have symptoms of cervical myelopathy, it would be best to have this evaluated. Schedule a consultation with me and we can evaluate your symptoms.